My name is Dr. Sanjay Chatterjee. I'm a consultant clinical oncologist. I specialize in treating patients with head and neck cancer. Oral cavity cancers are a part of head and neck cancers. So I'm going to take you through the side effects that you will encounter while having treatment with radiation and chemotherapy. I totally understand that you've been through a lot over the last few weeks after surgery, the pain and the disfigurement that you may have had post-surgery, and now you're obviously even more concerned about the side effects with radiotherapy and chemotherapy. Look, the first thing I would say is that this is a curable cancer, a common cancer, and these are quite commonly treated in most centers across the country. Most consultants will be very well versed with these side effects, and if you face any problem during your treatment, the best thing first is to go to your own doctor and ask for help. But in general, these treatments are quite well tolerated. The first and the most common side effect that you might face during treatment is it is not given over one day, it's given over a period of time. So a 6-week period is what you have to devote. 6, and some hospitals may actually take 7 weeks to complete your treatment. So don't panic, keep yourself hydrated, keep yourself well versed with all the treatment policies that your doctors told you. And if you have any problems, like I said earlier, please contact your own team. The commonest side effect is fatigue, because you have to, after your surgery, you have to come and go every day for the radiation, and that by itself takes and draws a lot of energy from you. The dietitian, your team in the hospital who has seen you, should see you on a regular basis to keep you well fed, and your nutrition levels should be optimal. The second and another very common side effect is that you will see that there are ulcers that you develop inside the mouth. This is mainly because there's a lot of turnaround of cells in our mouth, in the mucous membrane, the pinkish area inside the mouth has a lot of turnaround of cells, and radiation will cause a break in those turnaround. That's why you will face some ulcers in your mouth. These are temporary ulcers, don't worry about it. Just keep your mouth well rinsed with salt and water, and this should get you over these side effects. If these ulcers increase in number and if you have pain from it, please ask for help from the treatment team, and they will actually give you medicines, painkillers to help you with this. The next thing that will develop is swallowing problems, and that's again primarily related to the pain and the swelling that you will have inside the mouth after radiation. Now, these swallowing problems are usually well dealt with if the food is soft. If you keep yourself well hydrated with liquids, these problems can be managed appropriately. If we come to a point where, in spite of softened food, liquids, or in spite of proper painkillers, your nutritional requirements are not being met, then you may need a feeding tube to assist you during the treatment process. The third and a very important side effect, although not that common during treatment, is further swelling. You might find that with the treatment, there might be further swelling of your face. Again, don't worry. If you have that, please go to your doctor, and they might check for any infections that are brewing inside and give you some treatment for that. Your voice box may get a bit of the radiation. When you are having the radiotherapy, this voice box can be swollen and your voice character may change a bit. Again, nothing to worry. It's a common process that may happen. So again, get and seek help from your treating team. Usually it settles by itself. Whilst you're in the acute phase or the initial phase of treatment, these are the usual side effects that you will face. Whilst the treatment progresses or finishes, you'll find that inside the mouth there might be some infections which may need attention. So whitish spots inside the mouth may need antifungal therapy. As further time goes and you're in your follow-up, you will find that the mouth can get a bit dry. If the mouth is dry, then you will have to carry bottles of water with you. I am certain that your treatment team will take all precautions to reduce these side effects of dryness of the mouth. But again, sometimes it does happen. Later on during follow-up, there might be some changes to the bones of your head and neck area, like the jawbone. If those changes happens, like swelling or pain, please contact your doctor. they might give you some medicines to get you over it. Apart from this, there might be changes in the way you look, because radiotherapy can cause what is called as fibrosis or tightening of your skins and other tissues. Now, if fibrosis happens and if you find that this is quite debilitating, again, please contact your doctor. They will teach you measures to try and get over the same. Like I said initially, this is a very common cancer, a cancer that may be cured in most occasions. So keep your spirits high, and I'm pretty sure, God willing, you will get over this phase. Thank you.